Dr. Manohar. Yes, sir. So, good afternoon, everyone. Welcome to the fourth webinar of the five webinar series being conducted. आवाज नहीं आ रहा है. Hello, can you hear me, sir? Can you hear me? Yes, yes, Manohar. Yeah. So, welcome, Dr. Manohar. Good afternoon, everyone. Good afternoon, everyone. Third webinar in the series of five webinar the fourth webinar being conducted the five webinar series regarding. आवाज नहीं आ रहा है. Hello, can you hear me, sir? Can
Sir, namaste. Can you hear, sir?
Namaste, Dr. Prasan.
Yeah.
So, how is everything?
ठीक चल रहा है, sir. एकदम very good. How are you?
I'm fine, fine, all well.
Audio
So,
is okay. Video is okay, sir.
pardon?
Audio, video, both is okay.
Yeah, both is okay. Can you once, I think you did they make you host? Okay. I will ask them to make you host so
Right.
that you can share your screen. Let's see.
हाँ, ठीक है, sir. Also with me, I have Sonia with me, sir. She's the dietitian who was working with us. Some parts of it she will also present.
Sure, sure.
Hmm? Yeah.
You have a OPD today?
I had OPD till now, sir. Now I have blocked between 3 and 4.
Okay.
Yes.
So we have engaged in this webinar.
Right, right, sir.
But thanks that you are coming here. सुबह ये जो डॉक्टर प्रसाद ज्वाइन हो गए उनको को होस्ट और प्रेजेंटर बना.
I'm able to share, sir. Actually, I'm able to share. एक minute.
Yeah, please do share, Dr. Prasad. Yeah, perfect. Presenter. I think yeah, they made you presenter. Yeah, perfect. This is perfect. Yeah, good,
Right. Okay.
perfect. So we'll wait.
Sonia, is there? All good?
Yeah, Sony is there.
Ah, I think so. Sonia, you're there. You can hear.
Okay, she has joined from other login. Okay.
Uh,
How is sir? Darshan Sankar sir.
he's fine, sir. He's fine. He's fine, sir.
So did you visit it again sometime in Mumbai, TMC?
I no, sir. Not after that.
Uh,
He didn't come again.
okay.
How are things, sir, in Bombay? What is happening, sir?
Mumbai, that's going on. The TMC work is going on, and the other collaborative projects are going on.
Hopefully, the center is. What is the plans? When it is coming up, sir?
It's next March 26.
March.
So
Okay.
that's what they are investing. But let's hope that crossing as of now it's going on well.
Okay. Okay.
Some other studies also planned with TMC.
Right.
Collaborative studies.
Right. Right.
How is the PDF work going on? The CCRS PDF work that is going at your center.
Which one, sir? CCRS?
Shaili Agarwal is working at your place.
That is going on well, sir. I think
Dr.
she is
Megha
in the.
and yeah,
Yes, sir. It is going on. I think she is moving forward in what she's doing. Yes.
good.
Yeah.
So we'll wait, Dr. Prasad.
Yeah. I'll close my video and we'll
Yeah,
wait, sir.
at 3 o'clock we'll start. And
Done. Done.
yeah,
Okay.
thank you.
You were not able to talk, is it?
Sir, I can hear you now. So good afternoon, everyone. Welcome all the participants. On behalf of CCRS, Ministry of Ayush and Central Ayurveda Research Institute, I welcome all the participants for today's webinar. This is the fifth webinar. Uh, that's what we are conducting last 1 week. This is the last webinar in the series on occasion of the 10th Ayurveda Day celebration. Today's guest speaker is Dr. Prasan Shankar, who is Managing Director at IAIN Bangalore. I welcome the guest speaker. I also welcome our Institute Head, Dr. R. Govind Reddy, sir. Uh, I request our Institute Head, Dr. R. Govind Reddy, sir, to please give the welcome address. Over to you, sir.
Uh, Thank you very much for opportunity to give the welcome address. And respected Honorable DG Sir, Professor Vaidya Ravinarayan Acharya ji, and respected Honorable DDG Sir, Dr. N. Srikant Sir, for giving the opportunity to conduct this uh, integrative oncology webinar series. And today is the fifth webinar. We have conducted 4 webinars very successfully with a huge participation. So today is also there's a more participations in this webinar, and I'm seeing the names and very many people they are attending since first, second, third, and today's fifth webinar also. And today is one of the best topic for integrative oncology. That is Ayurveda, dietetics, nutrition, and cancer care. This is very important topic for cancer patients and to upgrade our knowledge. So today's renowned speaker, Dr. Prasanna Shankarji, Medical Director, Institute of Ayurveda and Integration Medicine, Bangalore. So, sir is a well-known speaker for this. He's working on the Ayurveda dietetics and nutrition. And moreover, my already I explained in all webinars. So my institution is working a lot for this cancer in the integrative oncology along with the TMC and ATTRAC in collaboration. And we have received the Center of Excellence. So with the efforts of the my technical in charge, Dr. Manohar Gundeti, and Dr. Vikram Gota from the ATTRAC, and even Pankaj Chaturvedi ji and Dr. Gupta ji as the directors of the TMC and ATTRAC. And moreover, we are doing a lot of clinical trials and even mechanistic studies. One of my institute, Dr. Dattatreya Dige, is working on the mechanistic studies, and even ovarian cancer is also working. And some of the PhD students also they are working on the even we had already did one study on the pain management with the cannabis. So that paper was also published in the OU. We are getting the very good results with the cannabis also. So in the pain management, and the TMC is already doing a many trials on that part of the cannabis. And my institution, moreover, working, and we have the very good OPD and OPD and even cancer OPD, special cancer OPD is there, and IPD is also there. We are admitting the patients. We are getting the more of the patients from the referring from the different modern hospitals and across the country. So we are getting the patients with the referred patients like chemo, post radio, post operative, and some of the patients for the palliative care, and they are coming for the only for even Ayurvedic treatment. They don't want for the allopathic treatment. They want to only for Ayurveda. Many patients, we have the statistical analysis also of these patients. And I don't want to take much more time. I welcome all the participants, especially for the my thanks and heartiest welcome of Mumbai and CCRES to Dr. Prasanna Shankarji. for this today's topic. And thank you very much, Dr. Manohar, for your efforts. And we are doing with your efforts, we are going ahead of my institution for the oncology. So thank you very much, and my entire team of the technical team, Dr. Lakshmanji, Dr. Vipin, and all the my officers. So we will do some a lot of work in expectation of my expectation in future also. Thank you very much.
Thank you, sir, for your welcome address. So now I will be introducing the today's guest speaker. It's my privilege to introduce Dr. Prasan Shankar. Dr. Prasan Shankar is an Ayurveda physician working in the Rasayan Tantra, that is geriatric unit at Institute of Ayurveda and Integrative Medicine, that is IAIM, at Transdisciplinary University, Bangalore. He treats various neurological and neurodegenerative disorders like strokes and Parkinsonism, arthritis spectrum disorders, supportive and complementary cancer care, supportive cardiac care, and other age-related problems. He has worked with HCG Cancer Center, currently also engaged in collaborative projects with Indian Institute of Head and Neck Cancer, Indore. He has also had the opportunity to train at Parkinson's and Aging Foundation under movement disorder specialist. He is involved in research related to Ayurvedic management of neurological disorders and supportive cancer research. Other interests include integrative healthcare, Rasayan, or regenerative medicine practices in Ayurveda, practice-based research. He is he is MD in Panchakarma from Rajiv Gandhi University of Health Science, Bangalore. He is currently the medical director at Institute of Ayurveda and Integrative Medicine, IAIM TDU. He has professional interest in integrative medicine, Ayurveda biology, and clinical research. So, with this short bio, I request today's guest speaker, Dr. Prasan Shankar, to take the dais to deliver his speech. Over to you, Dr. Prasan.
Thank you so much, sir. Thank you. Sir, is the screen visible?
Yes, yes, it is visible.
Right.
Can you make? Yeah, I think it's a full.
Yeah.
Can you make it full screen? Is it full screen?
From my end, it is full screen.
Yeah, I think it's full screen. You please go ahead.
Yeah. All right. So thank you so much. The time is about 3:07, so we will start and we'll try and finish by 3:45 or so. And then
Yeah. Yeah, before that, Dr. Prasan, I will take one moment. I request all the participants to please be muted because this causes inconvenience for others also, those who are listening patiently, not only the speakers. So I request all the participants, please kindly be muted yourself throughout the lecture. And after that, if there are any questions, please post in the chat box and you may raise your hand so to unmute yourself and ask the questions. So I request once again, please be muted. And the same is live streamed on the YouTube. So I have posted the link here. You may also feel free to share with others. Thank you. Over to you, Dr. Prasan. Thank you.
right, sir. So starting with the topic, over the last 50 years or so, healthcare and healthcare innovation has centered around infectious diseases. But over the last decade, we see that there is a shift from infectious diseases to chronic diseases. And in light of this shift, I think there is a serious need to reimagine public health as well as the way in which we approach healthcare in general. And so the earlier method, a reductionist method, may not be the most ideal method. There is a serious need to break silos and collaborate, and different perspectives will be needed from molecular biology to omics to genomics to cutting edge research, including systems like Ayurveda, artificial intelligence, real world data, and so on to help deal with the emerging public health problems. And definitely, cancer is one among such problems. I'm not sure if some of you are aware, but if I were to ask you, what is the incidence of breast cancer in India at what mean age is somebody being diagnosed versus what is the mean age of diagnosis of breast cancer in, say, in the United States of America. You can post your answers if you have any thoughts on this. But I was just reading this information and I found somebody was mentioning to me that the mean age, say in United States, where a person is diagnosed with breast cancer is about 52 years of age, and this is in stage one. So the patient still has lots of options for treatment. In India, the figures are quite staggering. We have mean age of diagnosis at 42, and most of these people are being diagnosed more than stage one. So they're being diagnosed in stage two or stage three, and so on. So therefore, I think while treatment and all of these aspects are also very important, but prevention of cancer is also extremely important, right? So in that context, and Ayurveda in the context of prevention, screening and prevention also becomes important, whether it is primary prevention, that is even before the onset, for people who are generally healthy, and those who have had incidents of cancer, how to see whether we can do secondary prevention and further progression. So both these are very important, and in this context, different aspects come into play, whether it is lifestyle, whether it is immune system, whether it is stress, whether it is gut health, and of course diet plays a very, very important role. Now, since most of us are Vaidyas, we know what the definition of uh, I am Samadosha, Samagni, Samadhatu, Malakriya, and so on is. So, I would like to summarize this and say that in essence, Ayurveda is a knowledge system that enables a physician to make observations. These observations, there are more than 5,000 different clinical observations that have been documented in the different classical texts of Ayurveda. Right? So, we make observations, we classify these observations, then we analyze these observations. We try to understand the story. So you act like a detective, trying to see which dosha, which dhatu, which srotas, which mala, and so on to make a story complete. So we try to understand the dynamic causes and effects of why, what, how, of the causations and the symptoms and the end result of that in the human context. And by understanding this and making this analysis, to the extent feasible, we try and correct it and modulate it and try and restore balance to the extent possible. Right. So there are more than 5,000 clinical observations. There are more than 6,000 medicinal plants that have been documented in the Ayurvedic texts. There are different quality standards for formulations, collections, and so on. There are more than 200,000 formulations that have been described all the way from Samhitas to Nighantus. There are more than 100,000 manuscripts. So there's a lot of wealth of information that is there in the text of Ayurveda. Now, coming to Swastha Purusha Lakshana, all of you know this sutra, Samamamsa Pramanastu Samasamhanano Naraha, Dridendra Vikaranam, Nabaleva Yabhibhuyasi, and so on. If you take each of these parameters, Samamamsa Pramana, or somebody who has proportionate musculature, strong, stable sense organs, one who can tolerate hunger, thirst, heat, cold, and can do good exercise, who has good digestion and metabolism, who has good aging, is aging, samajaraha, uniform muscle mass. So each of these points are extremely important today. I mean, we speak of strength training, people who have good muscle mass, we know that their recovery time from illness is much faster, and so on. So, all of these factors are very important. And such an individual, generally speaking, is able to tolerate disease well, is able to recover very quickly from illness, and so on. So, it's very important to strive towards getting to this level of health. Now, how do we achieve it? That's also very, very well described in the Ayurvedic text. These three Trayopastambhas are very important. Amongst these Trayopastambhas, whether it is Ahara, whether it is Nitra, whether it is Brahmacharya, Ahara is definitely very, very important. And even one of these Stambhas are weak, and we can get into trouble, right? And we understand this more and more when we start dealing with problems, we deal with patients, then we deal with complications of people, and we realize how important each of these three pillars are in day-to-day managing of patients, because they directly or indirectly influence Agni, Ojas, Dhatu, and so on and so forth. Now, again, in the Ayurvedic context, we have said that there are Ashta Ahara Vidhi Visheshayatana, there are these 8 important principles. So, to understand the Prakriti of the individual is definitely important, but to understand the Prakriti of the food is also very important. And the way you map the food to the Prakriti of the individual is also very important, because the way in which one Prakriti can manage certain foods is not the same as some other Prakriti. So, this is very important. Second, Karuna, of course, is very important, the way in which you process foods, and we'll take an example a little later on. How do you pair foods? What kind of foods can be combined? Can you combine milk and buttermilk, or can you combine fish and milk, and so on? So combinations of foods are very important because you don't want to overstimulate doshas. So food pairing is very important, and I think Ayurveda gives very beautiful principles and framework for food pairing. Quantity of food is very important. The general rule that one fourth, one fourth, one fourth is very important. Today we see that in areas of blue zones where people are living more than 100, people follow such rules of one fourth, one fourth, one fourth. Right? Then desha, that is the geography, is extremely important. Kala, that is the time. Now, in the context of time, we can speak about the individual in terms of age, the disease status, and so on. So all of these factors very important when designing food. The person himself is very important. So personalization is inbuilt into the Ayurvedic framework and thinking of how we design food. Putting together, so this creates a very beautiful framework in which we can think about food, design food, and design diet program for individuals. Again, Nitya Sevani Aharas. Now, the selection of Nitya Sevani Aharas is also very important. These are not only based on nutritional values, but I mean, if you think about it, they have given a set of foods, and these set of foods, if you stick to these sets of foods, generally speaking, you are trying to maintain the balance of the three doshas as much as possible. Because when the three doshas get into imbalance, they can lead to problems and diseases. So you don't want to overstimulate a dosha. You don't want to constantly take foods that are ushna. You don't want to constantly take foods that are tikshna. You don't want to constantly eat food that are abhishandi. You don't want to constantly take food that are dosha vardhaka and so on. So you have to be able to balance out so that you're eating a sort of food that is not overstimulating. And in this context, whether it is cereals, shashtika shali, godhuma, yava, mudga, the kshira, grita, amalaki, dadima, draksha, jangala mamsa, and other herbs, they seem to be, and there are some more descriptions in different texts. We can always make a very comprehensive list. They seem to be able to contribute to your nutrient requirements, whether it is macronutrients or micronutrients, right? So to just to give you an example, moong dal we all know is praised very highly in the Ayurvedic texts. And mudgo laghu kashayo ushno prayo vatakapapa sarva dosha prashamana kavapitta prashamana. So it has got so many benefits that have been listed out. Now, it is also rich in protein. It is also rich in fiber. Fiber is very important. Soluble fibers help in creating a sort of gel-like structure on the gut. They help in helping microbiota improve. Um, Important in our lab, some time back they had done some experiments, and they looked at different legumes, shimbi dhanyas, and we found that in mudga specifically, we found that a specific constituent called phytic acid is extremely low. The amount of phytic acid is about 170 per 100 gram, whereas in all other legumes it's much much higher. Now, this phytic acid is shown to be something that's an anti-nutrient factor. It prevents absorption of different kinds of minerals. So it is found, so phytic acid binds to minerals, making them harder for your body to absorb these micronutrients. Therefore, excessive phytic acid in any of the legumes can be actually counterproductive. And therefore, the way in which we process moong or process legumes and eat it definitely has a role to play in the way in which we absorb the protein and all the micronutrients that come along with it. And the fact that moong has low phytic acid may be a reason why it is something that can be had on a regular basis as a nitya sevani ahara without causing any long-term problems or any dosha aggravation and so on. Similarly, it has very low trypsin inhibitors. Now, trypsin, as we all know, is also very important to break down proteins. And when there's low trypsin inhibitors, the breakdown of the protein in moong becomes much easier. And if the breakdown of the protein in moong is easier, then the uptake of protein is also higher. So it has many benefits in terms of nitya sevani ahara. So that's why moong is possibly praised as something that is very good to have on a day-to-day basis. Now, amlaki, again, as we know, amlaki is called vayastha, something that is useful for longevity. Today, everybody says you must have blueberries, lots of berries in your diet. There are antioxidants and so on. Amla is also a berry and very important food that one can have on a day-to-day basis. Uh, some of the experiments in our labs have shown that if you take amla versus take vitamin C, that the uptake of iron is almost 2.5 times more with the use of amla as compared to only vitamin C. So it is one of the richest fruits in vitamin C. It is very rich in polyphenols, and polyphenols are also very important because they are compounds that support your immune response. They aid digestion, they aid metabolism, they help uptake of minerals and so on. So it's again a very important fruit that one can have on a day-to-day basis. Omissions are also very important. Why have they said that certain foods should not be had on a day-to-day basis? Now, this is also extremely interesting. I mean, dadhi, for example, is not something that you have, something that is abhishandi, something that is guru, something that is shita, excessive ushna, and so on. So many things, red meats, many things have said not to be had on a day-to-day basis. Just for example, one example we can give is of masha. Now, masha, people say, can be in the Ayurvedic context, while there are many forms of protein, masha is also praised for the fact that it is something that can good muscle. It will give you good muscle mass. But it is not something one would have on a day-to-day basis. There are certain methods in which you can have it on a day-to-day basis, but generally speaking, you would not have it on a day-to-day basis. And if you see the profile, while it has good protein and good amount of fiber, it is very high in phytic acids and very high in trypsin inhibitors. And to be able to make it amenable or useful on a day-to-day basis, one of the ways that we do it is by fermenting it. So we find it, whether it is in north of India or south of India, we ferment the masha and then we can have it as an idli or a dosa or a vada and so on and so forth, but not just like that on a day-to-day basis. So there are certain food that we would not generally have on a day-to-day basis in this way. So the concept is that we often say that the environment is as important. The human environment, or we call the milieu, is extremely important, and how to maintain that milieu environment in balance is also very important. While a short-term sort of aggravation of doshas can be managed by proper diet and so on, and you may have small symptoms at the time when you have a short-term aggravation of doshas. But if you have subacute aggravation of doshas, you may have some more recurrent symptoms, but again that can be managed. But if short-term aggravation, subacute aggravation, then you continue to partake in the nidanas that lead to stimulation of the doshas, whether it is vata, pitta, or kapha, then you reach a state of chronic inflammation, and this chronic inflammation has a lot of downstream problems. And today, India is facing diabetes capital, obesity capital, cardiac capital, cancer capital. So all of these definitely are results of long-term disturbances of the dosha that are being manifest because of improper diet, improper lifestyle, and improper food, and so many other factors today. There's pollution, there is microplastics, there are so many other problems today. And the environment, not just the external, but the human environment, internal environment is becoming pro-carcinogenic. And therefore, if you now your chances of getting into cancer become that much higher. Therefore, very important is that we try and maintain this balance of samadosha. Now, in this context, Agni becomes very important. And today we'll look at Agni in the context of diet also. So, Agni is very important. And as we know, it is something that is responsible for digestion, metabolism, assimilation. If there's Manda Agni, there's Kapha Vriddhi, there's Tikshna Agni, there's Pitta Vriddhi, there's Vishama Agni, there's Vata Vriddhi. And indirectly, it affects all the doshas, dhatus, malas, ojas, and so on. Given today's context where there is a lot of santarpana that is happening, Langhana therapies, in my view, play a very important role. Right? Upavaso, Pachanam, Vyayamo, Atapam, Marutam, Tatha, etc. So, Langhana therapies, in my view, are very important. Dasha Prakara Samshuddhi, Pipasa, Atapa, Maruto. So, we have Shodhanas and we have Shamanas. And the context of Shamanas, whether it is Upasa, fasting, and the ways of fasting can also be discussed. Whether it is Pachana, use of herbs that achieve Langhana, whether it is a form of exercise, Vyayama, the right type of exercise that achieve Langhana, whether it is a form of diet, whether it is Manda, Peya, Yavagu, Vilepi, and so on, that help to achieve Langhana, whether it is Atapa Sevana, or whether it is Shut Nigraha, Vipasa Nigraha. All of these methods, when employed intelligently on the individual to try and achieve Langhana, becomes important. And to sort of substantiate this, some of you may have heard already of the concept of autophagy. And autophagy was given the Nobel Prize some years ago. Now, in the context of autophagy, a cell which is fasting or forced into a state of fasting or stress, it sort of breaks down the debris that is there within the cell, the proteinaceous debris that is there in the cell, is converted by the lysosomes into amino acids, and then these are put into circulation. The body uses this material for its own benefit. So autophagy is a process where we sort of congest the body, we re-energize the body, make it clean, and so on. So fasting or langhana can possibly stimulate autophagy. Further, gluconeogenesis is also stimulated during fasting. So during fasting, the body shifts from glucose to alternative fuels, and we force the body to utilize other sources of energy, such as fats that are stored in the system. So when you say gluconeogenesis, after 14 hours of fasting, almost 50% of the glucose is produced by other sources than direct food that we are eating. And after about 48 hours, almost 92% of glucose is produced by stored proteins from the body. So you're forcing the system to utilize all the sort of stored and unnecessary material in the body. So that's one more sort of benefit of fasting. The other is stem cell renewal through fasting and refeeding. Now, 24-hour fasting cycles have shown to enhance stem cells' regenerative capacity. They process rejuvenative aging stem cells and restore their ability to differentiate into various other kinds of cells. So this is also important because when you stimulate stem cells, then body is able to recover faster. Then there is a certain pathway called the mTOR pathway, which is a very interesting pathway. Many people are studying this in the context of longevity. And during fasting, this mTOR pathway activity decreases, it down regulates. And when the mTOR activity down regulates, it helps cells clear out damaged parts through autophagy. So it stimulates or it enhances autophagy in the system. And that again benefits the human body and the cells. Also, growth hormone is stimulated. Studies have shown that fasting can boost growth hormone levels by about 5 to 14 times within 24 hours. And fasting acts as a trigger that prompts the body to release growth hormones. So now, on one context, we are having doshas that are aggravating, and these aggravated doshas can lead to a pro-carcinogenic environment. And if you do langhana in different ways, whether it is panchakarmas or whether it is ahara or whether it is vyayama and so on, then we try to undo this environment and try to bring about an anti-carcinogenic environment of milieu. And so, by doing langhana, there are many benefits. Cognitive health can be improved. There is neuroprotection, cardiovascular health can be improved. You can optimize insulin sensitivity. Metabolic syndrome is on the rise, so it can undo a metabolic syndrome. It reduces inflammation. Cellular repair is improved, and so on. So langhana lakshana, samyak langhita lakshanas, vata mutra purishana, visarge, gatra laghave, and so on. All of these lakshanas can be achieved by doing proper langhana. Also, it is important to pay attention to the fact that we don't want to do ati langhana, because ati langhana can lead to problems. So with that part, now we'll move to a couple of diseases. And I have my colleague here with me, Dr. Sonia, who is a registered dietitian, and she, along with Megha, who's a biochemist and associate professor at TDU, we have done some work on the diet aspects in our hospital, and we'll share some of the data that we have collected in this context. So this is a case of a 74-year-old gentleman, and so this 74-year-old man had come to us after a GI endoscopy, and he had a stricture in the esophagus. He had been diagnosed with moderately differentiated squamous cell carcinoma and some metastasis in the lungs. Now, after the diagnosis, he came immediately. This was a recurrence. He had a second time. And this time he came to us and he said that I'm not able to eat. So he was not able to eat. He was not able to swallow. So at this point, we said to him, see, you're not able to eat and swallow. You must finish some minimum doses of radiation and chemotherapy so that you can at least swallow. Well, he was hesitant, but he went ahead and did it. And the fact that he did it really helped us, because when he came to us, he was still not able to swallow too much. He was coughing. He was extremely weak. He had body pain, back pain, bowels were regular. There was weight loss. And this is so immediately after he finished his fourth cycle of chemo, he came to us. And so we'll explain to you what we did in terms of diet and how we assessed him. So looking at his Agni at the time, there's a lot of Agni Mandya. And so we decided to do a sequential diet. We gave him Laghu Ahara, we gave him Manji, we gave him Mudga Dadima Yusha, we gave him slowly. So first we started with liquids, And over time, when he was able to tolerate more food, then we slowly started to introduce him with more solid kind of food and soups and broths, eggs, sattu powder, and so on. So slowly, sequentially, we moved him from something that was liquid to solid, right? And we will see what happened over time. So I will hand over to Sonia from here. Sonia, are you there?
Yes, sir. Yeah. Uh, Thank you so much for asking me to present the data on this prestigious platform. So, coming to the case, this is a 24-hour recall. So, basically, that means the past 24 hours what the patient has consumed. So, if you look at the data here, he was able to take a lot of solid foods as well, but then he used to mash it and like take it in a semi-solid or maybe liquid format. He was also on a few protein powder because he was advised where he went in a previous hospital. So overall, he was getting around 901 kilocalorie, carbs were 90, protein were 29, which was almost on a very low side. Next slide, please. So coming to the Ayurveda diet, so this is an actually hypothetical diet that we have designed. So with the help of Dr. Shaili, and our team together, we design a diet which is like based on the patient's requirement, as using like Ayurveda food concepts, what you would be suggesting for the patient. So these are some of the ingredients that we have given here. For example, raisins, then recipes such as Laja Tarpana, then bottle gourd soup, then pomegranate juice, then Mudga Yusa. So these were some of the examples that what as an Ayurvedic doctor would you suggest. So basically this was an hypothetical case. And if you look at the energy, we are a little bit on a higher side in compared to the 24-hour recall. Protein is also a little bit higher. So there we were 29, here it is 38. Fat is also a bit higher and carbo is also a little higher. Coming to the standard diet, so the Ayurvedic diet and the standard diet, these were the hypothetical diets that we designed to compare how we have changed the diet from the 24-hour recall to the integrative approach. So here again, so basically the standard diet is totally based on the ESPEN guidelines that I've used, and accordingly, like given suggesting him what are the foods that will be included without integrating Ayurveda. So again, here if you see, I'm able to meet the energy, the carbs, the protein that is required for this case. I've added a few supplements as well that will be suitable for the patient. Next slide. Yeah, coming to the integrated diet. So this is something that we worked on as a team together. So the Vaidya and the dietitian. So we had to talk about the case, and depending on the case, we would be suggesting these food items, and all of these are totally based on the Agni. So I will be also showing the data that we have got for our 33 patients, depending on the Agni, which is the caloric intake. So depending on the Agni, we suggest them the diet. So you can look here, the energy is also almost met and the protein is almost met, and the patient was also able to digest really well because we made here and there a few changes. To just to give you an example, so the supplement here, the Fresubin Onco, what we did is we gave that in milk first, and the patient complained with a lot of bloating, and then immediately we changed it to takra. He was able to digest well. So these are some of the few examples that how we try to integrate our diet. Yeah, so here I just wanted to show you one of the major thing that we found in our diets that we prescribe. So for example, if the patient is a Tikshna Agni or a Manda Agni, how would you design a diet? So what I've done here is I've taken 50 grams of horse gram in both the ways, and I've just changed the food format. So if you look here, 50 grams of horse gram, I pressure cook it with some onion, tomatoes, make it into a salad, which would be a better option for a Tikshna Agni. And in other case, I'm giving the same 50 grams with some pipli and making it a kulata yusa. So this would be a better choice for a mandagni. But overall, I'm going to get the same amount of calories and the protein. So if you see your salad is going to give you 182 kilocalories and soup is going to give you 175. And protein is almost the same. So basically, the concept here is we have the similar calorie and protein content, but just a different nutrient density. So a kilocalorie per gram is something that is different, but overall you're giving the same amount of calories to the patient.
Right. So thank you, Sona, for that. And so like Sonia mentioned, our whole concept here was to see whether we can design food based on the Agni of the individual. So while keeping the principle of Agni intact, can we design a diet that is sequential so that we are not overburdening the person? Because oftentimes, as Vaidyas and doctors who are treating patients, we understand, we see that when we are giving diets to patients, the complaint is that okay, we have to eat protein, but we start eating paneer day one, then they're not able to digest the paneer. If you're giving them something that is heavy and guru and so on, then it becomes very difficult for the person to digest it. So how do we combine systems to ensure that we achieve the same goal, keeping in view that the Agni cannot be hampered? So we slowly improve, and we can see that the approach that we used was useful in this patient because we were able to design the diet keeping the Ayurvedic principle intact and yet achieving the needed goal of energy and protein and other requirements that the patient really required. And these are some of the medicines that the patient was given. He was admitted for a few times in the hospital, and as of today, um, so we can see we have measured some of his parameters. The ECOG more or less remained the same, but quality of life substantially improved. Now it's almost been 2 years since 1.5 years since we have treated him, and he's still stable and doing his work at this age. His weight improved from 47 at that time to 51. Pain reduced from 2 to 1. Appetite improved from 1 to 2. Fatigue, as of today, is much better. And of course, the energy and the food that we had prepared for him in terms of the integrative diet was substantially better in terms of what was needed for him. And this is a gentleman who we have been treating. So this is one case. We'll show you one more case. Now, this is a patient of stage 4 hepatocellular carcinoma. She had come to us last year in the month of October. So in the month of October, she was diagnosed with stage 4 carcinoma, and she was being treated in a local hospital in Bangalore. And during the treatment, she developed pooling of saliva. She was not able to swallow food. She developed thrombocytopenia. So lots of problems that she developed to a point where she was not able to eat food orally, and so they had to put a nasogastric tube. So this was the condition that she was in. So she had stage 4 hepatocellular carcinoma. She had been given chemotherapy, and as she progressed with chemotherapy, she got worse in terms of her quality of life. Her weight was dropping. She was not able to eat food. There was a lot of secretion and sputum in the pharynx, and they had to put a nasogastric tube. So when she came to us, she could not swallow. She was on a tube. She had abdominal pain, discomfort. She had a lot of fatigue. There was weight loss. She had no appetite. And so this was her condition. So again, when we looked at her, we saw that Agni Mandya is there. So we gave her, again, similar concepts. Light food was light, simple. And slowly we, improved in terms of what we were giving her. And before I come to this slide, I will hand over to Sonia.
Yeah. So, since hepatocellular carcinoma is a is a condition where the digestion becomes really bad, and there are the able to digest the fat is also little difficult. So, I'll just show you that what were the concepts that we tried to do here to improve her digestion and to improve the absorption. So, this was a 24-hour recall. So, you can see that she was advised that she need to take a lot of protein in her diet, and all that she was doing was adding the paneer and then adding some chana dal and putting it in the mixie and then adding it to the rice tube. So it was like a full liquid diet she was on, basically on the rice tube. And then other sources of liquids were the vegetable soup, kanji, dal soup, etc. So which was totally coming around 623 kilocalories, and carbs were around 64 grams, and the protein was around 15 grams, which is quite low than the expected. Next slide. Coming to the Ayurvedic diet, which is again the hypothetical diet. So you can see here, the energy total was 827 kilocalories. The carbs were around 94 grams. Protein is around 18 grams. And here again, we have added few of our recipes, that is Mudka Amlaka Yusa, then Dadima Amlaka, which is the most common recipe that we usually give for our cancer patients. And we have seen a very good improvement in their appetite. This is a standard diet. So as I discussed before, what I would suggest to the patient, like without any Ayurvedic approach, just the hypothetical diet. So here I've given the pentasure hepatic, which is very liver specific formulae, and it has some branch in amino acid, which is going to help her to digest it very easily. And I have also suggested semile MCT oil, which is nothing but the coconut oil for a better absorption. Here again, if you see, the total calories are 1391, so almost able to meet what the SPN guidelines would suggest. Protein, though we were short of it, but since she is in a growing stage, 40 grams should be more than enough. So here comes our integrative approach. So as I told you, the Dadima Amlaka is something that we suggested for her, along with the Pentasure and then Semile MCT and the other recipes such as Laja Tarpana, Mudganna. So these were some of the classic recipes that we had suggested. And on and overall, if you see the future slides, you'll be able to see that we also removed her from the Riles tube, and then she was starting to eat normal foods like soft foods on her own. And when she got discharged as well, she was really improving on her diet with our integrative approach. So here also, like you can see, the energy has improved, the protein has improved, fats were also had improved, and carbs also had improved.
So these are some of the medicines that we had given her, and while she was admitted here, we did some simple therapies that would help her. So in her case, also we can see that appetite improved from 4 to 3. Constipation, she was very constipated when she came here. She got much better. Fatigue reduced. Weight in her case had improved from 51 to 52, but it also dropped later on, and we'll come to why it dropped. Her ECOG, her EORTC, all of these improved. So you can see the some of the pictures of the lady. So she was on a Riles tube initially, and almost within 10 days of being admitted at the center, we removed the Riles tube, so she was able to eat orally slowly, and she came to a point where at home she was able to eat roti. Now, the only point that I'd like to make is that this lady, after about 4 months of treating her, she was, of course, in very bad state in terms of cancer. There was metastasis and so on. And so she passed away about 4 months from the time of treating her. But during these four months that we treated her, her family later on sent us a message saying that these 4 months were the best time of her life because she could eat the food that she wanted to eat, and she was comfortable, she was pain free, her appetite was good, and so she lived very comfortably for the rest of the time that she was there with us. So this is some of the other data that is available. So we have done at least an analysis of about 33 patients, and I'll ask Sonia to walk you through some of the data that is presented here.
Yes. So this is the data set that I wanted to present. It's an unpublished data that we are trying to work on it, and we are writing the paper. So we just observed the different cases for 33 patients, and here you can see this is the 24-hour recall energy consumption, and this is the after. So significantly we have improved on the energy intake, and this is just the frequency of the digestive fire. So you can see the black one here is the pre-study data, and after the intervention, this the light gray is the after. So we had a few patients, we had irregular, but we did not have anybody in optimal. That is a samagni. We didn't have anybody in samagni stage, and after we could make two patients turn into samagni, but after all, it was like a big time follow-up. We need to do like 7 to 8 months. And then there was also intense digestive fire. So we had a frequency of different frequencies of all the patients together as well.
But most patients had Mandagni.
Mandagni, yes, Mandagni. And this is the macronutrient distribution across the different diets. So the energy, the protein, carbs, and fat. We didn't see much of the difference in the carbs and the fat, but protein, definitely there was a good amount of difference that we could see. Not only the quantity but also the quality. So we also took an overall patient reported outcome that patient really felt good after eating the diets that we had prescribed, like feeling lightness or feeling of fullness after the diets that we had prescribed. And overall energy and the protein significantly improved, but there was not much of a difference when we see in terms of carbs and in terms of fat. And this was something, the nutritional assessment that I did for the patients, PGSGA score, which is the patient generated subjective global assessment. So as the score decreases, the better the patient becomes. So basically, it is a tool to test the risk of malnourishment. And we saw that when the patient was getting discharged or going back home, he actually improved the scores. Like maybe the scores were lowered, so he was improving in his health outcome. And MUAC, we couldn't see much of the difference because these are some anthropometrical data, and it takes time for us to actually, improve the MUAC data. And weight change, here also there was not much of a change in the weight. But one thing that I would like to stress upon is the patients who had come, for example, come to us with the weight of 50, they remained at the same, there was no change. So no change was also a positive outcome for us, though they did not decrease or increase, but they did not change the weight. So which was again, different kind of a positive outcome that we had got. And this is the DQQ score of the 33 patients. Basically, it's the diet diversity questionnaire that we used and tried to understand how diverse their diets could be. And so we compared all the diets, the pre-study Ayurvedic, standard, and the integrative diet. And we could clearly see that the integrative approach had diverse food groups in the diet, and even the food frequency. So for example, if they were eating 3 meals in a day, we could improve their meals and go up to 6 meals in a day, very small quantities. And since like few of them were on Riles tube, we had to give them 2 hourly feeds or 4 hourly feeds, depending on the particular cases. So we also improved the food intake frequency in as a whole.
Right. So this is a concluding slide. So what we would like to conclude and say is that relying solely on one way of thinking may have its own limitations. And in the context of diet, here we see that if you put the patient in the center, then it is very important to ensure that the patient is comfortable, and yet we try and achieve the goal in terms of nutrition that we have to. Right. So modern nutrition has its strengths and its scientific methods and data that it has over the last so many years. But also Ayurveda has lots of strengths and insights. It has deep understanding of the concept of Agni, the concept of Ama, the concepts of Samskara, the concepts of individual constitutions. And so when we integrate these two systems, I think we unlock a very powerful concept, and the fusion enables us to deliver something that is much more personalized and effective in terms of healthcare. And I think that is what we were trying to demonstrate with this presentation. So I'd like to thank Manohar sir for this opportunity, and CCRS and CRI Mumbai for this opportunity. Thank you so much. And we'd like to acknowledge Dr. Bhargavi, who is a senior research fellow at the institute here, Ms. Sonia, who is part of this presentation, and Megha. Thank you so much. Happy to take any questions that you have.
Thank you, Dr. Prasan, Sonia, Veda, and the entire team. Congratulations for this fantastic work. I hope this will get published soon. A very interesting idea, because we are talking about integration at medicine level and other things like integrative medicine, integrative oncology, but this is something integrative diet. So very nice to hear that. You explained the concepts in Ayurveda as well. The modern dietitian is there. So very nice. We'll see any questions are there, and we can. The participants are requested to raise their hands, or you please uh, post your questions in the chat so I can read for Dr. Prasan. So before that, any question comes, Dr. Prasan, I could see that you mentioned about one software, that is DietCal. Can you tell us a
Right.
little bit more about DietCal software?
Sonia, would you like to take that?
Yes, sir. So DietCal software is a proprietary software. So you can install it on your system, and you can input, like you can create your own recipes. So I am using it for our classical recipes. For example, if you want to, have a takra recipe. So you would just standardize a recipe, like use 50 grams of curd and how much of water. It will auto calculate, what's the amount of energy, protein, carbs, and fats. So it's a very good software for researchers who wants to understand what is a diet composition, and also as a practitioner, that is also very useful in the clinical practice.
And this is available.
Yes, sir, it is available. It is somewhere around 6,000 per year. It's a subscription package. So 6,000 per year, as a practitioner, you will be able to avail the facilities.
Nice. But you are able to customize according to our Ayurvedic concept for that.
Yes, sir. Yes, sir. Definitely, yes.
Great. So there is one question asking Parvati. She is asking, since many commonly consumed fruits, vegetables, and nuts today, like beetroot, broccoli, or walnuts, are not mentioned in the classical Ayurvedic text, how can we advise the patients about their suitability based on Ayurvedic principles?
I'll take one shot at this, and then if Sonia, you have to add anything, you can say. So, yeah, this is of course been a challenge. I mean, for years now, Ayurveda has been incorporating foods of different kinds over the years. So, if you look at the text, we see something that is introduced in Nightus in the 16th century, something that is introduced in the 18th century, something that is introduced in the 12th century, and so on. So, evolution always happens, and the give and take of food and dietetic practices have been happening for centuries. So there is it's not something that is new, and I think in that context there are newer fruits and vegetables and so on. In a similar way, we can. So we may have to follow the same principles that are laid out. What is the rasa? And based on the rasa, there are certain algorithms. If it is Madhur rasa, generally speaking, it is Virya is Shita and so on. So we have to follow the algorithm of rasa, guna, Virya, Vipak, and based upon that, we can create some framework to be able to include these kind of foods into our list of foods which we may or may not advise to the patient given the context of that patient.
Yes, sir, that's totally true. So usually, for example, walnuts. So walnuts are little, guru in nature, and it's also ruksha. So I would not advise this for somebody who's having vata prakriti. So you will have to like sit and analyze, for some foods which is not given in a classical text, and trying to map it, that what would be best suitable for that prakriti. So yeah, that's what we will do.
Okay, interesting. This is something like Anukta Dravyas in the Ayurveda, and how you are going to assess the pharmacology, their variables. The next question, Dr. Himalata Dubey. Good evening, sir. Thanks for the informative presentation. Could you please explain mTOR regulation for cell repair?
Right. So, Ms. Dr. Himlata ji, so this is a complex topic, but I'll just quickly summarize it. So, mTOR is a pathway, and this pathway is called the mammalian target of rapamycin. Um, through this mechanism of this particular pathway, it has a fundamental role to play in cellular kinases, and this pathway is central to regulating cell growth, cell proliferation, metabolism, and survival. And like I mentioned earlier, when mTOR pathway during fasting, for example, when mTOR is down-regulated, autophagy is upregulated. So it has a beneficial effect in terms of giving about bringing about autophagy in the system. So it helps in cell growth and proliferation. It helps in improving metabolism. It helps in cell survival. It helps in sensing in the cell systems. So it's an important sort of pathway, and I think very being studied quite a bit today in the context of longevity, because when mTOR is being modulated, it can have beneficial effects. And my own hypothesis is that when we do langhana, whether it is through panchakarmas or whether it is through ahara, we are definitely playing around with some of these pathways, whether it is autophagy, whether it is mTOR, whether it is gluconeogenesis, whether it is growth hormone stimulation, and so on and so forth.
Okay, thank you. I won't see any question, but coming to your presentation again. Okay, one question is that while the patient is actively undergoing systemic therapy, how does the Ayurvedic diet evolve along each chemo cycle? Could you also
So
share?
I think,
Yeah, please. Sorry.
so I think we shared some of the patient that we were treating.
Yeah.
In the same way, I think we will take into account um, uh, Darshana, Sparshana, Prashna, the principles of Ayurveda. And in the context of Darshana, Sparshana, Prashna, if we find that there is Agni Mandya, then the kind of food that we're giving or the kind of formulation that we're giving will be to ensure that Agni Mandya does not increase. Because our objective, as far as Ayurveda is concerned, we say that Agni Moolam Balam Pumsam. If Agni is not good, then we are going to lead to Ama. So we don't want to create Ama in any way. So to ensure that Ama is not generated, we try and keep the Ahara Laghu and at the same time Supachya, at the same time as nourished, as nutritious as possible. And that's what we're trying to demonstrate with these two cases that we presented. And there are many cases that we have seen in this way that we can modulate and ensure that during the process, if the person is having Atisar or Vaman or Agni Mandya and so on, how we can do it. And also, one of the misconceptions people have is that Ayurveda is only giving this Laghu Supatyahara, which may not be true because you can shift it to normal food once a person is able to eat it. So it's not that Ayurveda is only giving this Laghu Supatyahara all the time and so on. You can shift it to food that is more solid and things like that once the Agni is able to take it.
I think that's a customized approach for patient to patient again. As you
Yes,
mentioned, in your study, many of the patients were having the Mandagni.
yes. The maximum number of patients had Mandakri.
Uh,
But given the context, I think because they are coming after chemotherapy, during chemotherapy, and so on, so the context is such. Yes.
so Dr. Mauli is asking for weight gain in palliative care. What type of integrative diet can help?
Yeah, yeah. So, I mean, if we follow the Ayurvedic principles, if Agni is good, then I think so. First is to assess the person. If the Agni is not good, we improve the Agni. Once the Agni is good, then slowly, I think slowly in terms of diet, we have to choose foods that are again not going to hamper Agni. So that is it is Madhura and Rasayana in nature. And also, I think one of the simple things that we have seen is that giving Grita slowly, giving Gritapana slowly can definitely be useful over a period of time that can help in improving Mamsa Bala and so on. While the need for protein in different ways can be important, and while the text also says Mamsa Mamsena Vardhate for person who eats Mamsa, and for person who does not eat Mamsa, there are many other options, whether it is Masha, whether it is Mutka, whether it is different types of Shimbi Dhanya, whether it is Shira, whether it is Shira Pakas, and so on. So you can choose the kind of foods that are Mamsa Vardhaka over a period of time to be able to achieve and ensure that the person does not get into cachexia or sarcolemma or refractory cachexia and so on by doing this. And of course, external therapies in Ayurveda also are useful, whether it is Abhyanga, whether it is Vastis and so on. So all of these can play a role to ensure that we ensure that the person remains stable through the course of treatment and quality of life continues.
Okay. Then Dr. A.K. Jain is asking, rather is complimenting wonderful presentation with lot of information. Congratulations. And also asking, the lean and thin cancer patient can do fasting for autophagy.
Yeah, so this is a point that I made earlier also. So I think Ayurveda also gives us this framework saying that Ati Langana is not good. Where to do Langana, which patient to do Langana, what kind of Langana to be done. So if we are constantly doing, say, somebody is doing intermittent fasting, it can lead to problem for sure. If you're continuously doing, despite receiving Langana Lakshana, you get into Ati Langana, then we are in a problem. So we have to know where to draw the line. If there is already lean, thin patient, then it becomes difficult to perform the kind of Langana that a strong patient can do. So we have to accordingly modulate treatment approach so that we maintain Samadosha as much as possible.
Okay, nice. So, no question, but in between, I will ask both of you, like a dietitian and Ayurveda person. So, how do we marry together the Agni and calorie, both the concepts together? Because they say this is a calorie base, and we say this is Agni base, and this is a very fundamental difference because the protein powder is given. They say you eat yogurt, you eat like high rich protein, something like that. But if Agni is not proper, that won't work. That's what Dr. Prasan will tell. But Sonia will tell, no, no, this needs this much of protein, this much of this thing, and this much of calories required. So, what is your take on this basically fundamental difference? Both of you.
Yeah.
Yeah.
So
So I will, sir, you want to go first?
no, you go ahead. Then I will tell.
Okay,
Yeah.
okay. So, sir, as you said, it was very difficult. I usually thought that it would be very difficult, this clash would be there. But since our team is very open-minded and, Prasan sir and their team always listen to what is the science behind why am I giving a protein, what kind of a protein is it. So I sit and explain that to him, and he also understands that this is something necessary for the patient and it improves the quality of life. So choosing the type of protein is also important. Like, any dietitian would not suggest protein, just, have any kind of a protein. But since these are cancer patients who might have a very, uh, uh, low GI power, so here we cannot suggest. And one more thing that we could analyze in our data was, though in the future, like in the starting of the diet, we could see that as the as the Agni was little, Tikshna Agni, the calories were increasing. But after our approach, the integrative approach, we couldn't make the correlation actually. So even though the calories were high, the patient was still under the Mandagni. So basically, there is no correlation of Agni and energy. That's what we found, and we could, come up with the results that even though your Agni could be Mandagni, but doesn't mean that you will be eating low calories. You can eat higher calories, and you can eat, better calories than what is required for your body. So there was no correlation at the end of the study that we found, but initially we were trying to make that correlation. Yeah.
Yeah, just to add on also, I mean, as Vaidyas, we have this mental block about protein powders. Many patients who are on protein powders will come and tell you, sir, it is not working, it is bloating, there is a lot of gas and all this. So, like Sonia mentioned, we have done some modulation. Sometimes the dose that they give, we will make it one-fourth that dose to begin with. Sometimes these kind of modulations also be done. Also, the substrate with which we have given it has, like for example, takra. When we mix takra with the powder, it really helped dosing it. So if you want to give 30 grams and 30 grams the person is not able to tolerate, then we'll reduce it to 5 grams and and then give it and so on. So we have done these sort of small experiments to ensure that the person's agni does not get hampered, because that is the most important thing. And once the agni improves, we can slowly up it, because we understand that there is a need for protein in patients, but we don't want to increase inflammation. We don't want to increase other problems in the patient. So keeping that in mind is very important to ensure that we can modulate and discuss and so on. And the open-mindedness with which we can discuss, I think, really helps. So that's also important.
Yeah, great. So I think coming on a common platform, understanding each other, that is what is needed. And basically,
Yeah.
what patient is needed is more important, and what is good for him, that is important. This is really interesting. I think what I can see here, do you use the, but I think Sonia has answered that question. I think one concept in Ayurveda, that is Viruddhahara, is always a topic that we always discuss when we talk about any disease, and one of the causative factor that may be a Viruddhahara. So I request both of you, first maybe Sonia and then Dr. Prasan, may throw some light on that.
Sonia, you want to say something?
Yes, yes. So this concept of Viridahara, I would not like tell you that we try to follow everything, but just to give you a few examples that we follow as modern dietitians are, like for example, hot and cold foods. So very common example that a lot of us are doing is burgers and the Coke, right? So it is like hot and then the cold. So these are some of the Viridahara. Even we try to advise the patients that there is some scientific evidence that hot and cold food can cause some kind of a discomfort when you're doing it for a long term. So maybe most of the Viridahara, there would be some scientific reason behind that, and I feel we should sit and explore that. Whatever is mentioned in the classics, if once we try to explore, there would be some scientific evidence to particular different types of Viridaharas.
I mean, one of the things that I've observed with Viruddhaharas, right, it's a interesting concept. is that especially when the person is sick, when the person is very sick, and you do Viruddha combinations, like you're giving fruit and milk and so on, you'll find that their ability to tolerate it become very low, and you'll find a lot of problems with patients who are doing Viruddhahara when they're very sick, right? So you can see the counter of it. That is, the if you're doing it when the person is sick, they definitely have a lot of problems trying to adjust with the Viruddha food pair that you're giving them. When you're generally healthy, you may not be able to see the effect so clearly, but long term Viruddhahara definitely can be a problem. So you can see it in patients who are sick, and that is indicating that you should definitely be careful about food pairing when you are healthy, right? And so the concepts of Viruddha definitely need a lot more study and understanding, but they have a lot of relevance, because when you're mixing viryas, when you're mixing gunas, when you're mixing different dravyas and rasas, the way in which you mix it, tradition also has its own direction to us. You can go to any, whether Maharashtra or Gujarat or Kerala or Tamil Nadu, or even you go to Italy, the way in which they mix certain foods, you will find that there are logic to it, and logic will be demonstrated with biochemistry and other factors. So one should respect some of these factors, and one must try and understand the science behind it if you do not understand it otherwise. But it's an important concept, no doubt.
Sorry, seems I got disconnected in between. I don't see any question here, but I want to inform this gathering about one of the document that has been published by Ministry of Ayush. This is on food recipes from Ayush, a small booklet PDF available online. The interested ones may go through this. This has been developed by Ministry of Ayush, and Dr. Sulochana, she is assistant director at our Bangalore Institute only. Madam has worked on this document along with other team. So I have shared that link here. So Dr. Prasan and Sonia, and I don't see Dr. Mega is there. Dr. Mega, are you there?
No, sir. Actually, ma'am is in a class.
Okay, okay, that's fine. So thank you all of you for this very nice lecture and very thoughtful interactions rather, and the data that you have presented, the clinical scenarios, and I wish that it should come the publication soon, and the other ongoing projects also will be coming with their results. So I wish all the best for your entire team for continuing this work. Thank you very much for sparing your valuable time here, Dr. Prasan, and sharing this experience here. Also, I thank to all the participants who joined here and spared their time and interacted lively in this session. So today is the last day for this webinar. This is the fifth webinar. So on behalf of CCRS, I thank to all the participants, all the stakeholders who were participating in the last 5 webinars. I could see many faces or many names. I could not see these faces, but I could see the names, the participants. They are many of them are have attended all the webinars. So thanks to their interest and their patience for attending and their zeal for the in the quest of knowledge. Thank you very much, and we look forward to be interacting with you people again and again. On behalf of CCRS, again, thanks to all the speakers who spared their valuable time here and came here to share their knowledge. I also thanks to our DG CCRS, Professor Ravinarayan Acharya, who took this initiative, and Dr. N. Srikant, who is the Deputy Director General, who supported this idea, and the entire the structure and the schedule, and our director, assistant director in charge, Dr. R. Govind Reddy, and the team at CCRS, the IT team, who provided a nice platform for all the webinars to conduct these webinars. Dr. Subhash is there in the IT, is a research officer there, who coordinated with the IT team, and my colleagues in CCRS, my colleagues at CCRS Mumbai also. They are behind me. I am just as a front face of the institute. But I thank all the our team for their continuous support. My fellow Dr. Namrata, she has been constantly working for sending the links, mails, providing the forms and everything. So thank you, Namrata, for your support, the entire team. With this, we'll stop here, but I request all the participants, I look forward to welcome you again for the web conference, which is scheduled on 19th of this September, that is day after tomorrow. This is a 2-hour session where we are inviting the experts in the integrative oncology to share their experiences in the field of their practical experiences, institutional experiences, and also this will be followed by one panel discussion. So this will be entire 2-hour session. I look forward to all the participants to come here again, and again have some interactions, very lively interaction. So with this, thanks to all. Namaste. Good evening.
Thank you, sir. Thank you.
Thank you very much, sir.
Thank you, Professor Vittal. Thank you.